An allergy is the response of the body's immune system to normally harmless substances. In most people, these substances, also known as allergens, pose no problem. However, in allergic individuals, their immune system can identify an allergen as a threat and produce an inappropriate response. In the UK, 40% of all children have been diagnosed with an allergy. Allergy symptoms can affect all aspects of a child's day-to-day life, including their education, health and well-being, and social activities. The most common allergens are pollen from trees and grass, house dust mites, mold and damp, foods such as peanuts, tree nuts, milk, eggs and shellfish, furry animals such as cats, dogs, horses, rabbits and guinea pigs, stinging or biting insects such as wasps and bees, medicines. When a person comes into contact with an allergen, it triggers a response which causes release of substances and chemicals such as histamines into surrounding tissues. It is the release of these substances that cause the allergic reaction. These substances usually cause local symptoms in a particular part of the body, such as the eyes, nose, or a small patch of skin. Allergic reactions usually happen within a few minutes of exposure to an allergen, but symptoms can take up to 2 hours to present. Anaphylaxis is a potentially life-threatening, severe allergic reaction. It's a medical emergency and requires immediate treatment. The substances released within the body during an anaphylactic reaction are released into the bloodstream and cause a whole body response to the allergen, rather than a localized response seen during a milder allergic reaction. Symptoms of anaphylaxis usually occurs within minutes of exposure to an allergen. However, reactions can also take up to 2 hours. If a child is experiencing anaphylaxis, they must be given adrenaline via intramuscular injection into the thigh. This is called an adrenaline autoinjector, or an AAI for short. Most responses to allergens do not result in an anaphylactic reaction. However, if you are unsure, it is safer to administer the adrenaline. Symptoms of an allergic response can vary from child to child, but the most common symptoms of a mild allergic reaction are rashes or hives visible on the skin, swelling or itching in specific areas of the body such as the skin, eyes, ears or lips, a runny nose or sneezing, an upset stomach, nausea or even vomiting. During an anaphylactic reaction, a child can experience life-threatening problems, which are often described as the ABC symptoms. These include A. Airway, swelling in the throat, tongue, or upper airways, tightening of the throat, a hoarse voice, or difficulty swallowing, excessive drooling or dribbling. B. Breathing, sudden onset of wheezing, persistent coughing, shortness of breath, noisy breathing, or breathing difficulties. C. Circulation, dizziness, feeling faint, sudden sleepiness, confusion, pale or clammy skin, loss of consciousness, and the child may report a sense of something terrible happening. When tragedies occur due to an anaphylactic reaction, it's usually because people have difficulty in differentiating the symptoms from those seen in a milder allergic reaction. That's why it's critical to be able to recognize the difference in the severity of symptoms. Avoiding known allergens is the best defense to prevent allergic reactions from happening. However, accidents can happen. Some people can experience allergic reactions to allergens they have been in contact with before, with no problems. So, it's important to know how to recognize the signs and symptoms of an allergic reaction and understand treatment options. All children with allergies should have an individualized allergy action plan, and schools should ensure that staff members are aware of changes or updates to a child's plan. If a child with allergies does not have an up-to-date allergy action plan or access to an autoadrenaline injector, AAI, if one has been prescribed for them, they must obtain this from an appropriate healthcare professional immediately. A mild allergic reaction can be relieved by administration of an antihistamine at the first sign of a reaction. A child's prescribed antihistamine will be stated on their allergy action plan. Additional food, outside of meals, should not be given to children with known food allergies, and food provisions should be carefully considered during off-site activities and school trips. Extra care should be taken by school staff, including catering staff and pupils, to reduce the risk of cross-contamination. All allergens should be clearly labelled on food products to help avoid hidden ingredients. Schools should make reasonable adjustments for children with food allergies, for example, providing the option to bring in packed lunches rather than eating school meals. Fostering an inclusive environment at school can help children with allergies feel less anxious and reduce negative connotations surrounding allergies. This can help to promote a safe environment for children to share their concerns about their allergies and feel comfortable. Anaphylactic reactions must be treated via intramuscular injection of adrenaline into the thigh, using an adrenaline auto-injector device, which is known as an AAI. Adrenaline works by preventing cells in the body from releasing the substances produced in response to exposure to an allergen and reduces the symptoms of an allergic reaction. If a child is in anaphylaxis, 1. Administer the AAI without delay and follow the child's individual allergy plan. Always bring the AAI to the child. Do not ask the child to go to where it is. Make sure you note down the time the adrenaline was given. 2. Help the child to lie down on their back and raise their legs. This will help to raise their blood pressure and reduce feelings of dizziness. If the child is feeling short of breath, they may benefit from being propped or sat up. Avoid any sudden change in posture, even if the child is feeling better, as this may cause a drop in blood pressure. 3. Call for an ambulance. Tell the ambulance staff this is an emergency case of anaphylaxis. Anaphylaxis. State the school's address, including the postal code. 4. Call the child's parent or guardian. The effects of adrenaline can wear off quickly, and the child may need to be given a second dose. If the child's symptoms have not improved within 5 minutes of administering the first dose, you can give a second dose of adrenaline in the other leg. It's very important that every child who has been prescribed an AAI has 2 AAIs on their person or placed in an easily accessible location. This is in case they require a second dose or the first dose has misfired. To be accredited as an asthma and allergy-friendly school, the school must have an emergency AAI device stored on site for these situations. If a child having an allergic or anaphylactic reaction also has a diagnosis of asthma, they may need to be given their blue salbutamol inhaler via a spacer after they've been given their AAI, as an allergic reaction can often make children with. There is no need to remove clothing to administer an AAI, but take care to avoid buttons, zips, or thick seams on clothing when administering the AAI. There are 2 types of adrenaline auto-injector, AAI, but they contain the same medication called adrenaline, and they work in the same way to reverse the symptoms of an allergic reaction. If using an EpiPen, hold the EpiPen with the blue cap pointing towards ceiling and the orange tip pointing towards the floor. Blue to the sky, orange to the thigh. Remove the blue safety cap by pulling straight upwards. Place the orange tip at 90 degrees to the child's outer thigh. Push the orange tip firmly into the child's outer thigh at a right angle until you hear a click. Keep the AAI in place and hold firmly for 3 seconds before removing and safely discarding. If using a Jext pen, hold the Jext with the yellow cap pointing towards the ceiling and the black tip pointing towards the floor. Remove the yellow cap by pulling straight upwards. Place the black tip against the child's thigh at 90 degrees or at a right angle to the thigh. Push the black tip firmly into the child's outer thigh until you hear a click. Hold the injector firmly in place for 10 seconds before removing and safely discarding. Massage the medication and AAIs should be safely stored with or close to the child, but not locked away in cupboards where it cannot be accessed quickly or easily. All medications should be stored in their original packaging in a cool, dark place at room temperature and kept out of direct sunlight. In secondary schools, some children will be capable to keep their medication on their person, but this needs individual assessment for each child. All medication have expiry dates, and these should be checked regularly. If you notice that medication is out of date or close to expiring, families should be informed to replace personal medication, and emergency generic medication should be replaced by the school as soon as possible. An AAI should contain clear, colourless solution. If the solution is discoloured or contains particles, it should be replaced, even if it's still within its expiry date. AAIs are single-use only and need to be disposed of correctly and replaced straight away. Used AAIs can be given to the ambulance crew or disposed of in a yellow sharps bin if you have one. School staff can only give generic or emergency AAIs in schools for children who have an allergy plan and parental consent. If the school's generic AAI has been used, it needs to be replaced as soon as possible. If you suspect that a child without an allergy plan is experiencing anaphylaxis, then call 999 and seek advice. Make it clear to them that your school has access to an emergency AAI. A child with allergies will be given an allergy action plan upon diagnosis by a medical professional. The plan does not need to be updated unless there are changes to the allergens or medications. The plan includes symptoms of an allergic reaction and will state the details of the child's prescribed medication for both a mild or moderate and severe reaction. The plan also includes step-by-step instructions of how to administer an AAI. The administration of the AAI will differ depending on which device the child has been prescribed. Parents should bring a copy of their child's allergy plan into school, along with their child's allergy medication, which should be clearly labelled with their name and class. This plan and their medication should be easily and quickly available and accompany the child on school trips.